Good morning, everyone. Let us describe today about traction and its principles. Definition of traction says that it's a mechanical force applied to the human body in such a way that it separates the joint space, thus stretching or elongating the soft tissue surrounding the joint. Traction can be applied manually, that is by bare hands, or by the belt, also can be applied by mechanical device, that is known as traction device. Traction can also be applied by patient's own body weight. Thus, classifying traction, it can be classified into mechanical, self, positional, and manual. Talking about history of traction, traction was first stated by Dr. James Celiax in his Principles of Treatment of Technique, that is known as Celiax treatment technique in the field of orthopedics. This is the table what he used to induce the traction. He first stated that traction, if given for lumbar or cervical spine, can reduce the mechanically impinged nerve related pain. Thus, traction was developed in the field of orthopedics. Coming down to the several types of traction, it can be divided into electrical, OTD traction, that is over the door traction, and mechanical traction, where electrical traction can be further divided into static and intermittent. Sorry for the spelling mistake, it is intermittent. Electrical mechanical traction unit. This is most commonly available in any kind of physiotherapy clinic. This provides traction induced via motor to various body parts. It's specifically given for lumbar and cervical spine via a belt or collar attached to the human body and the motor respectively. Forces given by this unit to the human body can be up to 70 kg. The unit allows fine, accurate control of the force being applied and also allows variation in patient position. Thus, the patient can be either in supine or prone when he is on the electrical mechanical traction unit. Disadvantages of this unit can be it is very expensive to afford, mobilizes broad region of the spine rather than either only C4 C5 or L4 L5. It mobilizes the entire cervical or entire lumbar if attached, induces hypermobility for a non-affected joint. For example, if C4 C5 is the exact place where the person wants to give the traction, in electrical mechanical traction unit, entire cervical spine is induced with the traction force rather than only C4 C5. Thus, C2 C3 might undergo hypermobility. This is how electrical mechanical traction unit looks like. The first image is for the lumbar and second image is for the cervical. Electrical traction, as said before, can be divided into two parts, static and intermittent. In static, the amount of force does not change with the time. That is, if you set for if you set some amount of weight, that is for 15 kg for cervical, it has to remain 15 kg throughout the traction duration of the therapy. In intermittent, amount of force changes with the time along the hold time and the relax time. Hold time is known as traction on time, when the traction machine or the traction unit is delivering the traction force, whereas relax time is known as traction off time. There is no traction force delivered to the patient during relax time. Coming down to OTD traction, over the door traction for cervical spine. It is specifically given only for cervical spine. It cannot be given for lumbar spine. Subject is specifically in sitting position. Subject cannot undergo supine or prone as seen in the electrical traction unit. It can be inexpensive and also can be done at home. As you can see in the image, cervical is properly stabilized with various sets of cloth or the belt which is attached to the pulley to the door, over the door, and at the other end of the door a weight is given which gives the traction force. As you can see, the pulley is at 90 degree, giving the maximum traction force. Self-traction. This is a type of traction that uses gravity and the patient's body weight or force exerted by the patient to exert a distraction force at the spine. Advantages: it can be done for both cervical and lumbar spine, inexpensive, can be done at home, less time consuming. It can also deliver intersegmental traction. Disadvantage: the force applied during mechanical traction, that is by any device, is much more compared to the self traction. Thus, mechanical traction is overly beneficial compared to self traction. Positional traction. This is most easily usually done in the home-based program. It involves prolonged placement of a patient in a particular position that helps to reduce the tension of certain set soft tissue. Although the local force associated with this form of traction is unlikely to cause any joint distraction, it may effectively reduce muscle spasm, stretch the soft tissue, or exert a centripetal force on the disc by spinal elongation without joint surface separation. Thus, in positional traction, there is no specific distraction involved or induced in the joint space. All here is happening is the soft tissue which are under tight or under spasm are specifically stretched by positioning a patient. Positional traction may be used to treat unilateral symptoms originating from lumbar spine and valuable component of a patient's home program during early stage of recovery when symptoms are severe and irritable. Collectively speaking, positional traction is nothing but a stretch given in a specific position for a prolonged period of time. That can be either sideline, prone, or supine. This is how the positional traction looks. Placing a towel or a pillow which can be rolled and the patient is side lying and it is just placed at the lumbar level in order to stretch the concave side of the scoliosis. The concave side should be the top side. Advantages of this kind of traction is nothing but it reduces the muscle spasm, it is inexpensive, it can be performed by the patient at home itself. Disadvantage is force induced during the mechanical traction is much more beneficial compared to positional traction. Last one, manual traction. Manual traction is applicable of force by the therapist using bare hands or belt in direction of distracting the joint. Advantages: effectively it decreases the muscle spasm by stretching the soft tissue. Inexpensive, traction can be delivered in a pain-free range, but make sure the assessment is done before application of the traction. Can be modified to all the levels. As you can see, the first image is the patient is using the therapist is using the belt and the patient is lying in the crook lying position where the hips and knees are flexed. This technique is used to deliver the lumbar traction. Quantifiable results of this technique is less significant to deliver the intersegmental traction for lumbar spine. But yes, qualitative analysis has shown significant improvement in the patient perspective. The second image shows the bare hand technique manual traction for cervical spine. Now, this this technique in this technique patient is using two hand technique. One hand is placed on the forehead and the other hand is placed on the neck. Both the hands are just distracting the cervical segment from each other. Disadvantages: traction time of traction and force induced is much more beneficial in mechanical traction. This is the last slide, that is the skeletal traction we'll be briefing about in the next class. But just to make sure, the frequently done skeletal traction is the Steinman pin, which is done for tibia to distract the tibiofemoral joint. Thank you. Let us do this in the next class.